Hello and thanks for joining us. I'm Dr. Alan Mask. I am an internist here in North Carolina and also the medical reporter for WRAL-TV. Let me pose a question. Are doctors, nurses, dentists, and advanced practitioners doing everything they can to help prevent infections during routine procedures? Experts say that we could be doing more. North Carolina continues to see transmission of illness and outbreaks of infectious diseases such as hepatitis B and C, where patients have been infected because of unsafe needle and medication practices during routine procedures. Now, to address this problem, we're here to spread awareness about a rule, the North Carolina Administrative Code, that requires healthcare settings, such as doctors and dentist office, to have a staff member on site who is trained to prevent these types of events. The rule is called 0206. Now, joining us to talk about infection prevention and this code 0206 are two experts, Dr. David Weber and Dr. Zack Moore. Dr. Weber is a professor of medicine and pediatrics at the School of Medicine here at UNC. He's also a professor of epidemiology in the School of Public Health, the associate chief of staff for UNC hospitals, and the medical director of the statewide program for infection control and epidemiology. Dr. Moore is a state epidemiologist and chief of the epidemiology section of the North Carolina Division of Public Health. And Dr. Moore, we'll start with you. Tell us about this Rule 0206 and how it got started.
Sure. So Rule 0206, as we usually call it, is a rule in our North Carolina Administrative Code that dates back to 1992. And when it was first put in place, it was intended specifically to prevent the spread of HIV and hepatitis B in healthcare settings. So Rule 0206 has two basic requirements. The first requirement is that any healthcare setting that performs clinical care and performs invasive procedures has to have a written infection prevention policy. Now, this applies not just to places that are conducting surgery, but to any place that uses needles to puncture skin. So this is if your facility draws blood or gives injections, then this rule does apply to your facility. The second main requirement for the 0206 rule is that one staff member in each facility has to be responsible for this infection prevention policy, and that person has to complete a state-approved course in infection prevention.
Mm-hmm. And Dr. Weber, tell us about your experience. I know you're here at UNC with this rule and how it applies to what your practice is all about.
So this is critically important. We've seen both in North Carolina and throughout the United States outbreaks of diseases such as hepatitis B and C due to inappropriate use of needles, that is not following one needle, one syringe for entering a vial, and inappropriate use of multi-dose vials. And so it's critically important for people in ambulatory care settings, individual doctors' offices, assisted living, every site to have somebody trained in how to prevent those types of infections.
We're focusing here today mostly on the outpatient setting. We really want to spend most of our time talking there. I understand we've had some instances where there have been some outbreaks. Give us some examples, if you will, Dr. Moore, about that.
Sure, and unfortunately we have seen disease transmission in lots of different types of outpatient facilities, from cardiology practices to orthopedic clinics to urology practices. So this is not a problem that's limited to any one type of place. One example that occurred here in North Carolina was an outbreak of hepatitis C in a cardiology practice. And what we found when we went to the cardiology practice to investigate is, first of all, they were not in compliance with this rule. They did not have a written infection prevention policy, and they did not have a staff member who had completed the state-approved course in infection prevention. As far as their practices, what we learned was that they were taking multi-dose saline vials and using those saline vials for more than one patient. And they were unfortunately reaccessing those vials with contaminated syringes, which allowed for hepatitis C to be transmitted from one patient to the next. And ultimately, we had 5 new infections that we were able to track to that, and more than 1,200 patients who had to be notified and tested for bloodborne pathogens. That's just one example of the type of practices that we see and why we feel it's so important for people to be aware of this requirement and to comply with it.
Yes, there have been other incidents as well, Dr. Weber.
Oh, yes. They have really broken down into 3 major types outside of hospitals. The first is not following the rule of one needle, one syringe for entering every vial, so you contaminate the vials if they're used between patients. The second is inappropriately, all medicines that are FDA approved are labeled as devices Single use, meaning you use part of it or all of it and throw the rest away, even if not completely used. Single patient use, so you could use it for the same patient multiple times, or multiple patient use. So you have to follow that rule. And of course, anything that goes between patients, any devices such as the glucometers, which are used to check blood sugar for measuring insulin, they need to be, if they're shared between patients, properly cleaned and disinfected between patients.
Talk to us some more, Dr. Moore, about what we can do to help keep patients safe from diseases like hepatitis B or hepatitis C. What are some more of the fundamentals that we need to be following?
Sure. Well, I think there are several things, and some of them are what we would consider basic common sense. Everybody knows that hand hygiene is very important to stop the spread of infections, although actually complying with good hand hygiene is sometimes harder in practice than it is in theory. And some things are a little more nuanced, and that's why we feel it's important for people to take these infection prevention courses so that they understand how diseases are transmitted. You know, we often hear from doctors, particularly around safe injection practices, I don't need to hear this, I've been giving injections safely for many years. And our response to that is you don't necessarily know if your practices have resulted in transmission, because hepatitis B and hepatitis C often don't present with symptoms for many years. So there are bad practices going on out there because people just don't have the knowledge of how diseases are transmitted. And that's what we'd like to address with increasing awareness and compliance with this 0206 rule. And one other brief comment is that we have seen a big increase in hepatitis C infections recently. So unsafe practices that maybe people have gotten away with when the prevalence of these infections was lower in the community, as we see more and more of these bloodborne pathogens, it's more likely that those will result in transmission and in outbreaks.
Dr. Weber, this is the law, it's the healthcare law. What can healthcare workers, doctors, nurses, and dentists and so forth, what does it really mean to them in terms of their practice and what they can do to help their patients?
So the goal here for all of us who provide medical care is to provide it in as safe a way as possible for our patients. Some of them are very simple, that is, healthcare providers should be immunized against vaccine-preventable diseases such as influenza, mumps, measles, rubella, and hepatitis B if they deal with blood. Certainly hand hygiene before and after every patient contact, and that can be done simply in most cases with just one of these alcohol waterless washes. But then, as Dr. Moore already said, specific training on the more difficult to follow rules for sterilization, disinfection, safe needle practices, and proper use of medication vials. And we need to remember that we can't see these bacteria and viruses, so we need to follow these guidelines all the time, because there's no way for us to tell just from looking at a vial or a syringe whether it's contaminated.
Why have we had the problems so far? Is it because of chaos, because of a busy outpatient practice? Is it because of negligence? Is it because of lack of training? Where do you see that as falling out?
So I see this, part of it is just we're busy and therefore we forget simple things like hand hygiene. But part of taking the courses is to learn ways of improving hand hygiene compliance among yourself as well as your colleagues. And part of it is from lack of knowledge about the practices you need for proper sterilization, disinfection of shared medical devices, as well as the importance of safe needle practices and following the FDA guidelines on the proper use of single-use and multi-use devices.
I'll let you both comment on this. I hadn't heard of this rule before, the 0206 rule, and certainly all of us who are participating and watching want to be in compliance. How can healthcare facilities meet the requirements of 0206? And I'll open that question up to both of you.
Well, I will start off, and Dr. Weber's group, the North Carolina Statewide Program for Infection Control and Epidemiology, or NC-SPICE, offers state-approved trainings in infection prevention. Those are the required trainings that people need to complete to comply with the 0206 rule. And those trainings are available online in some cases, depending on the type of practice that you're in. Those can be accessed at infectionfreenc.com or ncspice.unc.edu.
And I should say we need to give a lot of credit to our state health department. They have been a leader in this. And it's important to understand that over the last several decades, most medical care is moved from a hospital acute care basis out into ambulatory surgery centers, private physician offices, assisted living, so much more care is being provided. And this rule requires people in those settings to be as equally trained as we've trained people in the hospital. And this is where most of the patients are getting their care now, so it's absolutely critical. And North Carolina has been a model for this type of education requirement, and actually, and through NC SPICE, mechanisms to actually provide this education. It's a model for the entire United States.
So again, a written infection control program, and then one person on site who's taken the course and come back and sort of oversee what the practice is doing. We want to mention again the websites. I'm sure people are interested in getting their facility certified and bringing the practice up to date. Again, it's infectionnc.com. That's the one website that you can go to. We'll show that on the screen as well. And then we also have spice.unc.edu, spice.unc.edu. That's where practitioners, dentist office, doctor's office, et cetera, outpatient facilities can go for specific information to get themselves up to speed. So again, we thank you for being with us today, for that valuable information, and we thank you for joining us.
Thank you.
Thank you.